This event today is really troublesome. It's troublesome because, once again, the people who can least afford to are being denied, attacked, and their services are being diminished.
The City Council goes through a very extensive process with the administration discussing areas in the budget that need to be modified in order for the budget to be brought to balance. Throughout the months that we have discussed the budget for fiscal year 14, was there ever a conversation about immunization clinics closing?
No.
Never! Never! New York City is abandoning one of its core functions. One of the functions of a Department of Health anywhere in the world is to identify disease, to map it, to control it, to isolate it, to confine it, and if possible, to eradicate it. One of those weapons that they use in doing that core function is immunizations.
These projected closings of these clinics represent another attack on people's ability to get health care locally where they live. It makes staying healthy so much more difficult for the residents of New York City and these communities. We need more local immunization opportunities and not fewer.
We should be gathered on the steps of City Hall today because it is National Immunization Awareness Month. We should be out here reminding parents to ensure that their children are getting immunized so that they can start school in September. Instead, we are standing here in the middle of National Immunization Awareness Month, urging the administration not to take immunizations away from children, to keep these clinics open. It is August. This is when children get prepared to go back to school. This is when the rush is to get their immunizations so they can start on time in September and be healthy next to the other children in the class.
Right now, the mayor is destroying the public in public health. The mayor is destroying public in public hospital. The mayor is destroying public in public education. The mayor is destroying public in public housing. We have seen the mayor is destroying the young and the old, and we all have to collaborate in order to put a stop to it.
Why make it more difficult for families to make sure that the kids have the right shots? Why make it more difficult for families to ensure that their kids are healthy and that nothing else is going to happen in the classrooms? These clinics should remain open, and the amount of money to look at the saviors doesn't even make sense. This is penny wise, pound foolish.
We need to see that there is effective change that addresses the needs not just of Wall Street, but of Roosevelt Avenue, the Grand Concourse, Flatbush Avenue, and Victory Boulevard as well. That talks about the whole city. And we need to see that that happens.